The expansion of telehealth services has transformed care delivery, expanding access for millions of Americans who faced barriers to care related to transportation, mobility limitations, or geographic isolation. In rural Minnesota, the dramatic expansion of telehealth capabilities, much of it driven by the vision and effort of one passionate physician, has made a tremendous difference in supporting the labor and delivery needs of community residents. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. Women facing long travel distances for regular visits to their obstetrician are less likely to receive the level of care they need and more likely to experience serious complications and higher rates of maternal mortality. That's why one OB/GYN specialist in northern Minnesota has created the Family's First Rural Maternity Health Collaborative Program, a telemedicine platform for expectant mothers that she calls my love letter for my patients and the people that I'm called to serve. Let's join the conversation.
Welcome, everyone, to our podcast today. I'm Dr. Chris DiRienzo. I'm the Chief Physician Executive for the American Hospital Association. You are joining us from the AHA Leadership Summit. We are in the Innovation Hall, and you can hear all of the energy and excitement at this incredible meeting here in San Diego. And I am incredibly excited to get to spend a few minutes with Dr. Johnna Nynas from Sanford Health Bemidji. She is a practicing OB/GYN, and the story that she has to share will absolutely blow you away. So, Johnna, welcome to the program. Thank you for joining us.
Thank you for having me.
You've been recognized recently as one of CNN's champions for change, and that's grounded in the incredibly foundational work that you do. Why don't we just start by talking a little bit about what that recognition means to you personally and professionally?
Well, it certainly came as a huge surprise. When you come to work every day, you're doing the job that you're doing because you love the work and you love the people that you're working with and the type of impact that you have on the community. So to be recognized for something that I love so much is truly an honor. When we set out to create the Family's First Rural Maternity Health Collaborative Program, we really started with the idea of what were the barriers in our community, because the barriers can never be more than the why. And so when we identified all those barriers and started putting the work together and pulling the ideas together and collaborating with each other, it just became this very passionate project of mine. And the way I looked at it when I submitted the final submission was, this is my love letter for my patients and the people that I'm called to serve.
We can hear it in your voice. It obviously touches you deeply personally, and my understanding is you have some pretty deep roots in this part of rural Minnesota. Would you speak to that a little bit, and then, why you needed to turn to this groundbreaking telemedicine program to support the labor and delivery needs of the people in your community?
So I have background growing up in rural Minnesota as a kid on a small family farm, and realizing that it was 30 minutes one direction just to access medical care. That was standard growing up. I didn't know any different. And as I started to go through my medical training and residency, you started to see some of the disparate impact that has. And certainly the national data supports that. Women living in rural communities are 9 times more likely to die in childbirth than women in urban areas. And that's an unacceptable statistic. Where I'm located in Bemidji, Minnesota, we're very geographically isolated. We're 4 hours north of Minneapolis. And we are surrounded by 3 different Native American reservations. And unlike the American population, where 1.3% would be Native American, in my county where I live, 22% of patients are Native American. So that really called into light the need to work on those disparate outcomes and the obligation that we had. I think really looking at how we could break down those barriers is what led us to the work that we were going to do, and kind of leaning in with the communities that we serve and work with daily, and hearing from our patients what the barriers were that prevented them from getting care was where we started our work.
It's the exactly right place to start. And it's fitting that we're sitting here in the Innovation Hall at the AHA's Leadership Summit, because we know that the challenges that America faces with high quality and safe labor and delivery care, there's never going to be one solution for those. And so we need the kinds of local innovations that you've been able to drive up in Bemidji as examples that we can then replicate across the country. So talk to us a little bit more about those key initiatives within the Families First Rural Maternity Health Collaborative, how you sought the funding, how you built those pillars, and then what they actually do to bring care in such a unique and innovative way.
Sure. We applied for funding through HRSA's Our Moms program, or Maternity Obstetric Management Strategies program, and we were awarded $3.67 million over 4 years to do this work. And when we broke the work down, we kind of have some basic pillars that are focused on excellent obstetric care coordination and management, transportation services, prenatal care and education services, support services related to other factors from childbirth, from lactation to home visiting nursing programs. And then lastly, our virtual care program to try to bridge the gap that exists due to distance and transportation. Within the program, some of the things that we're seeing is we've created a very strong partnership with our collaborative partners, which includes Red Lake and Cass Lake Indian Health Services, Scenic Rivers Health System, which is our local FQHC. And then we also have partnership with Prime West, which is our Medicaid servicer, and then Beltrami County Public Health, and then Sanford Medical Center Fargo to provide some maternal fetal medicine outreach for those additional services that we don't have locally.
And how far is that from where you are in Bemidji?
So our nearest tertiary care center is Sanford Fargo. That's 3 hours to our west.
Oh my goodness, 3 hours.
Yeah. And this whole problem is exacerbated by the fact that since 2019, we have had 4 regional labor and delivery unit closures. So now I have patients who are traveling 3 hours one direction to come for a prenatal visit with me. So when we looked into some of the digital options and virtual options that we had available, it became very clear that we needed to change the way we were thinking about this problem. So what would it look like if, instead of expecting my patient who lives in a geographically isolated area in Red Lake and asking her to come to my clinic 2 to 3 times a week for monitoring, for management of her diabetes and her chronic hypertension and her other chronic medical conditions that contribute most to severe maternal morbidity and mortality? What would that look like if I brought that care to her? So one of the ways we're doing that is by really expanding our use of OB telemedicine visits. These can be used for really any visit that doesn't require an in-person appointment for either labs or ultrasound or imaging. Patients are given a low-tech kit, including a blood pressure cuff and fetal heart rate monitor that they can use at home for their visits, and then they connect with their medical provider via a digital platform through the My Sanford Health app. The nice thing about this is, from a provider standpoint, we made very sure that we didn't limit this to just low-risk women, because the reality is, where we're located, if women aren't coming to us to seek care, then they're just not getting care at all, and that's unacceptable. So we opened it up to anybody, and what we've found is not only are patients very accepting of that telemedicine platform and doing visits themselves, it's also better engaging women in understanding their care. And as a physician, you can appreciate how important it is to have patients who really understand the why behind what we're asking them to do. One example of that is monitoring patients with hypertension in pregnancy. When they come into my office, it's a passive process. Someone's checking their blood pressure. Someone's telling them the number of the day and is it good or is it bad. Whereas if the patient's at home and she's monitoring her own blood pressure, I've had to give her some education and some guidance on, this is what I worry about. This is what I don't. These are your parameters for coming and following up for care.
Yeah.
So now that patient not only has some insight into her condition, she's taking ownership and responsibility for that. She's reaching out and saying, I am having these symptoms and I took my blood pressure. I noticed it's high. I think I need to come in. What's my next step? And that takes on a step further within the communities that we serve. So by educating women on these conditions during pregnancy, we're seeing an impact where patients have been cousins or aunties or relatives or friends of other pregnant women who've said, I don't feel good today. I feel like I have a headache. My vision's really blurry. And my patient has said, you know, my doctor talked to me about preeclampsia. We should probably check your blood pressure cuff.
Wow.
That's really impactful if you think of what that can do for communities.
It's impactful, and it effectively flips the challenge that we face around maternity care in this country on its head. I mean, we have all heard about the shifts in demographics and changes in the kinds of people living in communities. And we know there's a massive workforce crisis, and that you need several thousand people living in a community just to be able to support one OBGYN. But what you've done is taken the strength in those rural communities, which we know is a tight-knit fabric in this country, and by projecting specialist expertise into those communities, you've tapped into the power of that fabric. It's incredibly inspiring, and at the same time, I know it's got to have been challenging.
Certainly has been challenging. Some of the initiatives that we haven't even begun to realize yet is we still need to implement satellite clinics, which are going to be regional hubs where there's already a pre-existing clinic. One example is in Panema, Minnesota, which is in Red Lake Nation. They have a medical assistant, but not necessarily a provider. So our next steps are to build out the infrastructure so there is telemedicine equipment and broadband. Because the reality is not all rural patients have access to a smartphone or to broadband. So now instead of expecting a patient to have those tools, that patient can just go down the street to their local clinic and receive that care virtually. And we're working to outfit everything from remote antenatal testing and non-stress tests, consults with diabetes educators, nutritionists, potentially maternal fetal medicine, all from the comfort of the patient's own community. They can come in and they can upload their continuous glucose monitor so we can see exactly how their blood sugar control is, so we can better manage those chronic medical conditions that contribute most to severe maternal morbidity and mortality. But as you can imagine, it's a simple idea,
right,
but implementing it is a completely different story. We have definitely run into some barriers when it comes to working between different agencies, and especially with a government agency that were not realized prior to starting our work. And it's delayed some of the implementation that we want to do, but we're still making forward progress, and we're really excited about that. I think one of the things that we've certainly learned from this is when you're implementing a new mode of delivery for care that's going to be shared across different entities, is to have those conversations with IT teams and legal teams early on in the planning process.
Absolutely.
Instead of springing it on them at the end.
That is a spectacular recommendation, and we always run into this when we're breaking new ground in healthcare, but you folks at Sanford have been so incredibly innovative, recognizing that you serve frontier communities, that you've got to innovate in order to get these folks who live in less than 7 people per square mile to the kinds of outcomes that you're able to. That's frankly one of the biggest benefits that we've seen in the Patient Safety Initiative, that the 1,500 plus hospitals who are members of the work have said, we spend so much time heads down in operations caring for patients that sometimes it's hard to lift our heads up and hear about the wonderful things going on all across this country. And so that's part of this innovation work stream. And in just the last couple of minutes that we have, I'm wondering, for all of the folks listening in today, hearing your inspirational story and the incredible work that you're doing up in rural Minnesota, what advice would you give to people, say, in rural Mississippi or in rural Massachusetts who are facing the same challenges and saying, gosh, I just need to take that first step to get the momentum going?
I think one of the most important steps to realize if you're looking to implement some programming is the time to solve the problem is actually not now. We're not solving today's problem. We're creating the infrastructure to solve the problems that will be in existence to support the communities that we will be 20 years from now.
Well said.
So that's what we're looking to do, and really having that forward-thinking mindset.
Again, this has been an absolute privilege, Johnna. Thank you so much for joining us. Again, this is Dr. Chris D'Arienzo. We've been with you live from the AHA Leadership Summit Innovation Hub, and thank you for joining our podcast.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.